Hello and welcome everyone to the Thrive series. We are so excited to have you with us here tonight. If you have attended the Thrive series with us before, thank you and for coming back. If you are new to the series, we are so happy to have you here. The Thrive program is a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota. We will be recording tonight's session, and as we do with every session, so that you can refer back to this recording. We do edit every recording before we post it to ensure privacy of this community. Today is the last session of our fall survivorship series with a special tribute to our BMT survivor community. I am pleased to now turn things over to our special guest moderator, Sasha Skendzel. Sasha is a clinical assistant professor of nursing at the University of Minnesota and an adult blood and marrow transplant nurse practitioner specializing in post-transplant survivorship and late transplant late effects care. As part of her doctoral project, she developed and implemented the mHealth Adult BMT Advanced Practice Provider-led Survivorship Clinic. In addition to her academic and clinical roles, Sasha has been involved in survivorship research, clinical trials, and special interest groups. We are delighted to have Sasha moderating tonight's session. Sasha, I'll turn it over to you.
Thank you so much for having me. I'm excited to be here, but more than anything, I'm excited to introduce you to this wonderful panel of experts we have today. Our first expert is Dee Anderson, a certified family nurse practitioner with Be the Match survivorship program. And she's been there for more than 15 years. She has more than 15 years of hematology oncology experience, specifically in blood and marrow transplant, benign hematology, and sickle cell disease. We also have Jen Byers, and she is a patient coordinator for the Be the Match survivorship team and has worked over 9 years in patient advocacy at Be the Match. Finally, we have Sarah Rusch, a physician associate by training and has been in practice since 2007 with several years of pediatric bone marrow transplant experience at the University of Minnesota. Sarah recently joined the Be the Match team as a manager with patient services. Dee, Jen, and Sarah, I'll let you take it away from here.
That sounds great. Thank you so much, Sasha. I'm going to go ahead and share my screen, and we will go ahead and get started. All right. I can just move some stuff around. Hang with me for a minute. So, more than anything, we just want to say thank you so much for having us here this evening. This is such a great opportunity. I am so grateful for everybody's able to join us tonight. We were able to see some of those demographics of those who are registering, and there is representation from all corners of the map, which is really kind of neat, as well as a really diverse representation of where the individuals might be in their cancer journey at this time. So welcome to all of you. It is awesome to have such a great turnout. I personally am up in northwestern Minnesota, up at Alexandria, if anybody's familiar. And we are getting our first decent snowfall of this season, which is getting the town excited. I think we've got a few inches out there already, with certainly a whole lot more to come. This was just taken this morning, and so it's quite a bit different already. So what we're here to talk about, obviously, is Be the Match survivorship. As they had said, Jen, Dee, and myself are leading this new program within Be the Match, and it is something that didn't exist many months ago, or even years ago for that matter. And so right now our goal is to do a whole lot of outreach to introduce the program to patients who have been through transplant, and so that we can share with them the resources that we have available, and hopefully better guide them and navigate them through their survivorship journey. So the key takeaways that really we want to share with all of you throughout this presentation is that survivorship is a complex journey. There's no denying that. There are no two journeys throughout this process that are ever going to be alike. But most importantly, Be the Match is here and they are available to help and support the transplant patients as well as to support their caregivers. So at Be the Match, at survivorship support, we believe that the survivorship care really should promote good quality of life for our patients, and that comes by supporting their physical and their emotional needs. The program provides free personalized services for our patients and their caregivers after the transplant process, but we're also a resource to the healthcare providers in their community too. We have resources that we can share with them, and we can help to transition them back to their primary care providers or back to their hematology and oncology providers with some of the resources that we have available. Really, we're here just to bridge the gap in that post-transplant care by offering the education, the support, any assistance that we can to these patients and their providers and their caretakers. Really, when we look at things, we find that there is this enormous need, and we can very well see that the role of those educational initiatives to engage and empower our patients and the caregivers in the improvement of their psychosocial health is so valuable. It's a multi-pronged approach to address these concerns that can be really impactful in ensuring the long-term success of transplant. So just a little bit of background and research that kind of helped the organization come to the conclusions that this was necessary. There's been studies done. This slide is busy and it's complicated. We realize that. And we've looked at this slide before and thought there's potentially a way to make it less busy. But at the end of it all, it represents transplant. Transplant is busy. It can be messy. It can be complicated at times. And this is just a genuine reflection of that continuum. And really looking at these different boxes on here, it's easy to see for a patient who's gone through transplant how this flow works. But essentially, these patients, they start out in their primary care office with their physician or their provider. Something abnormal shows up that leads them or prompts them to do more of a workup, and eventually prompts them to make the referral to a hematologist and oncologist, in some situations a geneticist. From that time, the diagnosis, when they get to the hematologist, oncologist, obviously more comprehensive workup gets done. We reach a diagnosis, they determine an initial treatment plan, and then they make that referral off to the transplant center. From the center to that consult, for those who have made it to that point or who are familiar, you'll get to your transplant center. They'll do that pre-transplant evaluation. There's a long medical and psychological workup, and they also initiate that donor search. For some people, they're fortunate to have that match within their family, and for others, they're not, and that means going to the registry. Once those phases are completed, then of course we move on to transplant itself. And then from the transplant, where we reach these 4 squares, is really where you start to see some of the variation and where we can start to see some gaps in healthcare, gaps in the care in general. After patients get their transplant, some centers do have a long-term follow-up clinic. They do have a survivorship clinic, and they take care of those patients themselves. They take care of all the imaging that needs to be done, all the lab work that needs to be done, those comprehensive physical exams that need to be done in the appropriate times. But not all transplant centers have that. They don't all have the staffing to support that, in which case those patients then get referred back to their hematologist and their oncologist or their geneticist. And the follow-up care is then left to that provider to manage. And sometimes there's some confusion and some miscommunication about how that follow-up care is supposed to look. There's also situations where the patient gets referred directly back to their primary care provider, which in the same scenario, it can create some confusion and some misunderstandings. And in surveys that have been done in the past, these community physicians say that some of their biggest concerns they have with this is that they don't know who's responsible for what. They don't know where they're supposed to turn when complications come up. If the primary care provider is supposed to talk to the hematologist, the oncologist, the transplant provider, the pulmonologist, the cardiologist, there's a matter of finding ownership with it. And this isn't a secret, this gap in healthcare, we all realize it exists. And so that's where Be the Match has spent some time trying to fill this gap and trying to fill this void so that we can provide better care to these patients and their families. aside from those challenges themselves, these other things that the patients experience are endless. I mean, this is just the tip of the iceberg as far as what those challenges are, but the physical changes that they experience to their bodies, the mental health changes that they experience, the fatigue, their sleep is disrupted, they've got chronic pain, they've got sexual dysfunction, which nobody wants to talk about. There's the overall burden of their symptoms, and those are just the physical aspects of it. And then you look at the psychological aspects, that they're struggling with depression, with anxiety, some people with PTSD from the whole process of transplant itself. There's the perceived stress that comes along with how much is on their plate and how they're going to work through it all. And then we get to the social factors, which is a category all of in its own, because these patients and their families are experiencing so much financial distress. Their ability to reintegrate into their social circles is different. They can't go to the activities and events. They can't go to their niece's wedding because they are immune compromised. They can't go to graduation. They can't go to a retirement party. Even the integration back into their workplace, back into the school setting for our college students, or into the high schools and elementaries for the kids too. That transition is really challenging for the same reasons. They don't have the stamina to keep up throughout the day, which might compromise a person's employment. They don't have the immune function quite yet to sit in a classroom or to sit in a cubicle. So they may need special accommodations. And those are stresses that often put people in position of falling behind educationally or losing their employment altogether. And then, of course, marital problems. Marital problems come up and are another one of those things that are really not talked about a lot. But there are studies that show 75% of marriages that have one person struggling with a chronic disease, that those marriages will end in divorce. So these things need to be addressed. They need to be acknowledged. There's more to it than just the body and just the cancer or just the disease. There are so many more complications that come up from it. And these are those things that we're really working hard to address so that we can better support. Apart from all those things too are the systemic complexities. I sound like I'm beating a dead horse right now, but there really are so many complications and hurdles to overcome. When the patient is transitioning from that full medical care at their transplant center and back to the community support, that's a huge change in their day-to-day. They go from being in a facility where maybe they were living at the Ronald McDonald House and they were seeing their transplant team 3, 4, 5 days a week. They're getting their blood drawn every one of those visits. They're looking at their electrolytes and their CBCs with a fine-tooth comb regularly. And then they get transitioned out to a primary care provider where, you have your appointments when you need them. It's not necessarily something that's scheduled. And so that in itself can really be hard for a family to accept and transition to. It can kind of feel like a cold turkey change. With that, there's variations in the follow-up models, like we talked about before. Some transplant centers have their own long-term care follow-up clinics or survivorship clinics, others don't. There's variations in the infrastructure within those transplant centers. And then, of course, the variations or the complexities that come with each patient's own social dynamic. What does their insurance cover? How far away do they live from that transplant center? Do they have a stable clinical status that allows them to get to their transplant center and the social support to help them get there too? I look at days like today, and for somebody who physically were to live in my community right now, if they were transplanted, the closest transplant center would be the University of Minnesota. That's a 3-hour drive. And if they needed to get there today, the roads are terrible. So for them to get from this point to that point would have been really challenging. There's not public transportation here for them to rely on. So if they don't have the social support to get them there, it really creates this conundrum of what can we do? And that's where we want to be able to support those clinical and community providers so that they can better take care of those patients so that we don't have to immediately knee-jerk refer them back to their transplant centers when it's not necessarily needed. But then, of course, still have the ability to virtually connect with them and talk with them for their support and guidance, but do it from our settings. So that all brings us to, our survivorship program and really our patient services program. I mean, it's more than just the survivorship team and program. There's a lot of services and people that are involved that really make this all go round. And so I do want to caveat that our survivorship program with Jen, Dee, and myself have the ability to give these patients resources and education, but this is a group effort made up of so many other teams within Be the Match. And a lot of them I'll showcase here throughout the next few slides. First and foremost, for anybody searching, and I'll tell anybody who's looking now, if you have access to these slides that we had sent out, these links on the slides are live links. So you should be able to click on them and it'll take you to the sites that are being referenced on each of these. I wanted to start with this one because this is the landing page for the survivorship program. This is our website. So if you're looking for something, if you see this pop up, you know that you found us. It's not something that you can get to right now through bethematch.com. You won't be able to navigate your way through there. Hopefully in the next few weeks you will, but we don't currently have that access. So you have to get there through this link. So save that so that you can access it, because it's like the golden ticket. And once you've got access to that, you can get around a little bit more within some of the links and resources that we have to offer. But I wanted to share that image so that you know what you're looking for. So our patient support center, our patient services, this is just a small image of some of the people that work with us, that work alongside of us and do some of the really heavy work. These are our navigators, and they are the ones that are taking the calls and are helping to direct everybody to where they need to be. They're often the first voice and the first person that you interact with when you're reaching out to be the match. Within our patient services team, within our survivorship team, as we said, we have our patient coordinator, which is Jen, and they are on the call with us right now. We have our advanced practice providers, Dee, our nurse practitioner, you know them, myself, as we'd introduced. We also have our patient navigators, which I said, and they are all certified oncology patient navigators. We have Spanish language navigators available. We've got a team that's specific to our grants, to the education, and to the clinical trials. We have our licensed social workers. We have 2 of them who are available for counseling services. And we also have social work interns that work alongside of us, or alongside of our social workers rather, to help to support the team. And then we have our patient and our caregiver volunteers who step in to do some of the peer connect roles and the one-on-one services, as they've been through the process before and they have that generous heart of wanting to be able to give back in some capacity. And that's a great opportunity for them to do so. So here's just kind of a list again from our survivorship program, but also these are things that are coming from our overall patient services team. We have the educational interventions for our patients that are all personalized. They're for the patients, they're for the caregivers. And like we said before, there's also some resources available to the providers too that helps to guide them through the long-term follow-up care. We have that ability for community provider outreach so that we can share those educational materials with them. We have our peer-to-peer support programs, which I'll talk about a little bit more in a couple slides ahead. We have the access to counseling and emotional support for our patients and our caregivers. We can also get you your access to the financial support, to the grants, the clinical trials, amongst many, many other things. These are, again, just a few of the things and ways that we can support everybody going through this process. We're here to encourage preventative health. We're wanting to support getting those lifestyle changes so that those transplant sticks, so that it works and so that it's not compromised in any way. We're here with the vaccination recommendations that come from our transplant physicians, and those new guidelines are actually coming out hopefully in the next couple of months. And of course, just here to promote the good nutrition, activity, sleep hygiene, all these things that are helpful for preventative health, to keep everybody healthy post-transplant and after treatment. We're here encouraging the surveillance, going in for those post-transplant follow-ups, getting the imaging that needs to be done, the blood testing that needs to be done, the screening that's recommended by your transplant team. Our interventions that are available when needed is the peer support. We've got survivorship chats, our Peer Connect program, those things which I'll talk about in a little bit, and then also the counseling and emotional support services. And then coordination of the care, again, with our long-term survival guidelines that are available for the community physicians. So this, I'll point out again, has a lot of live links on it. So you can access a lot of these resources that I'm referencing here. The 6 and the 12-month post-transplant care guides are excellent. They're like fold-out brochures that are just a plethora of information and really like a roadmap to help a patient going into that anniversary visit. It helps to guide them in what questions we might need to ask. It helps to guide them in what the physician might be asking them, what they might be looking for, and why. When the time comes for the 12-month and beyond, there's vaccination recommendations as well. Vaccines don't get re-administered until 12 months or beyond. those are available to be downloaded. Again, the link is here. It'll take you to the site, and it actually takes you to a site full of a whole lot of resources, but in particular are these 2 post-transplant care guides. Our long-term survival guidelines are for the providers. This is kind of the cover of it right now. I did not put a live link in here intentionally for that one because it is actively being updated right now, and it should be available, we were told, potentially by January. So I can communicate that when it is available, but I didn't want to put something in here that was going to be changed so soon. Our Living Now magazine series is excellent. It's just another one of those great things to have in hand to read about patients' experiences and hear about the process that others have gone through as they share their stories in these. We have an app called My Be the Match that's available for patients and caregivers. And this link here will take you to what's referenced as the GVHD Fast Facts, which is actually really helpful as GVHD tends to rear its head in the post-transplant era. So other things that we're offering throughout the survivorship program, as we had stated, Dee and myself are advanced practice providers. The 2 of us combined, we've been working with the hematology oncology transplant world for over 20 years. We're available to support our patients, their caregivers, their providers. By answering your questions, we can connect them with resources, provide educational materials, anything that we can do to specifically tailor stuff to their specific case, we will. We are more than happy to work with you via email. If that's how you feel most comfortable communicating, you can call us and we can talk on the phone. We can set up video chats through entities like this, Zoom, or through WebEx. I do like to put the caveat out there that Dee and I are not here making diagnoses. We're not prescribing any medications. I'm not making any recommendations to change your treatment plan, but we're here to kind of guide you and navigate you through the process. When you feel like you might be kind of floundering and not sure where to turn next, we have those years of experience behind us and can help to get you in the right direction. We can give you some resources to reference. And if we have to, we can connect you with the right people so that you can talk to the right person who might be able to answer those questions and make those changes most appropriately. And again, we're here for your caretakers too. So if they need to touch base with something, we're happy to speak with them. If your providers need to reach out, if your hematologist, oncologist wants to reach out and speak with us, we're happy to speak with them as well too. So contacts again are on here. These, you can access. This will take you to our primary website, which is the first one that I showed you. Otherwise, you can email us directly too. And that email goes to the 3 of us, so we'll see it right away. The counseling services are a very popular program within Be the Match. We have 2 licensed social workers, Haley and Ben, that have been with the organization for several years. And they are here to, support the emotional needs, to support the patients. They talk with a lot of caretakers too, and help just to cope through the process of transplant. They often will offer sessions that are about 50 minutes long, and they'll do those weekly for up to 8 weeks, but certainly they're flexible and that can be changed and modified to meet the patient's needs. It's, really about finding that reliable mental health related information that they'll help you get help these people to adjust to that role of being a caretaker, help the patient to prepare for their treatments, help to prepare for their transplant and what that prolonged hospitalization might look like. And also they're exceptionally good at helping to develop those coping strategies so that you can manage the emotions and the life stressors that are certain to come along throughout this process. And then, as I said, too, they also have interns that work with them, too, who are both incredibly brilliant minds and work alongside them, too. So you may see some faces that accompany them through some of the visits if you're ever in one of their sessions. So another one of our programs is focused on the grants. There's grants that are available that are to the pre-transplant era as well as some to the post-transplant era. And then there are some grants that are available for specific to the clinical trials. I had modified this slide previously because I had some dollar amounts in here, but the dollar amounts changed. And so I just ultimately took it out because I didn't want to give you misinformation. But there is essentially, for the clinical trials, there's patients that are, if they're enrolled or they're currently enrolling in a clinical trial and need assistance with those traveling expenses, there's funds that are available for that if they qualify. There is a grant available for patients who are 3 months plus post-transplant who are actively being treated for GVHD. And then as well as for those post-transplant within 3 years of their application submission if they've gone through transplant. this is a busy slide with a lot of words, but the moral of it is that there are grants available to patients in all phases of this process. And if you reach out to the team and touch base with them, they can certainly navigate you and help to find something that that patient might qualify for. And then also the clinical trials program that exists, same for that too, that I like to give the plug that for somebody who's going through a complication post-transplant, if your particular transplant center doesn't have an open study or an open trial that might speak to that complication, or they're not able to enroll you in something, they can reach out to Be the Match, and they'll connect you with our clinical trials search and support team. And they have the ability to comb through all of the clinical trials that are currently taking place across the nation. And if there is something they feel you might be eligible for, they can make connections between your physicians and that particular transplant center or treatment center, and help to find out if maybe you are eligible for something else that we just didn't, that they didn't know about at your transplant center. So it's one of those things that it never hurts to reach out and ask the question, because there are countless clinical trials that are taking place and popping up every single day. And Be the Match really has a very current list of all those that are available. Our Peer Connect program is pretty neat. It's a one-on-one program with patient volunteers. That these are people who have been through the transplant process already and wanted to give back, essentially. And so they are here to meet with patients one-on-one and share experiences, share emotions with them. Some of the volunteers will say, as he quotes down here, we'll listen, we'll laugh, and we'll just cry with them. We've been there, we get it. A lot of people find a lot of comfort in this, and we do have the ability to match patients as best we can if you are seeking somebody who is with a primary diagnosis the same as yours, or if you want to speak with somebody in your same age group, your same complication, if you want to talk about GVHD, we can tailor it to fit your needs and what you're seeking for to the best of our ability so that you get the most out of it. It's a great program that I think really offers a lot of support. And it's something that I think a lot of the younger patients really migrate toward, as that ability to connect with somebody else who's been through this experience. And then on that same note, as a survivorship chat is kind of similar, but on a little bit of a bigger platform. So our survivorship chats are more of a forum that has usually between like 8 and 10 patients registered to it, maybe sometimes a little bit more. We do these twice a month on predetermined topics. And it's a conversation that's facilitated currently by patient navigators, but it will be by our social workers in the future. We have some prompted questions that exist if there's a lull in conversation, but it's just a forum for people to voluntarily go into. It's a safe space to share their fears, to share their frustrations. You can speak without being judged. You can speak without being misunderstood, and just share what you've gone through, and hopefully connect with people who have also experienced the same thing, and kind of speak in a group chat, and talk about your GVHD. Or topics that we've had before were about steroids, and this recent month our topic was about giving thanks. There's, like I said, pre-decided topics. They're great. They usually have really great turnouts. This too is something that's quite popular, and I think another one of those things that the younger generation really enjoys. The next thing that's on there is our app. This is fairly new, and it's being changed kind of in real time as they're updating it and kind of tweaking it to be more patient friendly, but it does exist. This is the logo for it. So if you searched for it in either your Apple or your Android app stores, this is the logo that you'll find, and it's called My Be the Match app. It is something that anybody can download, but I'll caveat that for patients to register themselves as a patient on there, it does get verified through Be the Match. So not anybody can register themselves as a patient. You will be verified that you are a transplant patient. All caregivers, I believe, at this point in time can register and register as a caregiver. But this app has the ability for you to track your symptoms. You can participate in a virtual community with other patients and get support from our patient navigators. But track along your medications. You can track your hospitalizations, upcoming appointments. Just kind of a useful common ground place to put information in reference to it. But then also I really love that feature where they have the ability to have that virtual community too. So I anticipate that this app is going to evolve a lot in the coming year. But it exists right now. You can search it. You can put it on your phone. But again, if you have not been a transplant patient, you won't be able to register as a patient on it. This is one of my favorite things to showcase. This is a book that is so beautifully done. It's titled Blood and Marrow Transplant Journeys, Ordinary People with Extraordinary Stories. And this is a book, it's a collection, 6-chapter book, over 150 stories, poems, art that's been contributed by transplant recipients, by their caregivers. I kind of look at it as a nice little coffee table book. It's just this beautiful collection to sit down and page through and reference and read through people's experiences. It's just so beautifully put together. It is available. You can order it for free. Again, this link is here and it's active. You can click on it. You can get just the PDF download, or you can actually order the hard copy book, but it's an awesome just a piece of material to have in your home. I love it so much. And then of course, this is one of my last slides, I believe, but this part that I think is one of the more exciting aspects of transplant, what people kind of look forward to, is that communication that takes place afterwards. The post-transplant communications, I think, is something that most patients, a lot of patients, really look forward to, and it helps to give them maybe some closure to their journey. They are given the opportunity to initially have anonymous communications with their donor if it's agreed upon on both parties. And then ultimately, when the time is appropriate, they are allowed to exchange personal information and meet one another if, again, both parties agree to it. So it's a really, really, really wonderful thing. It's a beautiful thing when a transplant patient gets to meet their donor and have the ability to thank them in person for that selfless act that they gave. You know, they essentially gave life to a complete stranger, and it's just an amazing thing that kind of brings everything full circle. You know, we are a virtual survivorship program right now. We are here with the goal to improve the quality of life of our patients who have limited access to a survivorship program or follow-up care. Our goal, we want to ensure that our patients are feeling supported after their transplant. We want them to thrive in their survivorship journey. And we have so many personalized services that we can offer to them, and they're all free, as we have said several times throughout this process. And again, the ability to support their caregivers, to support their providers, but most importantly, to support our patients. We are here by phone. We can be available by email, by video. However you need to contact us, you can reach us. Contact information again is there, and it's again there. But yeah, we are so grateful for the opportunity to share our resources, our education, and our services with the oncology community and with the transplant community. And at that, I will open things up to questions if anybody's got any. The last few slides here are references in the appendix, which I'm not going to go through with a fine-tooth comb.
So we do have one quick question that came up in the chat. Are these new services that Be the Match just started offering to patients? And this specific person is asking because they were transplanted recently in June of 2020.
Yeah, I'll go ahead and answer that. That the services, a lot of these services have already existed. That there are things that are offered by our patient services. The survivorship program is new, and so bringing in our nurse practitioner Dee and myself, that aspect of it is new to have us here to help to coordinate it. Jen has been there from the beginning. They have pioneered this program. I've seen it take off from ground up. And so I've seen where all of these resources and educational materials have come from. So the things like survivorship chats, the Peer Connect, our counseling services, grants, financial support, those things have been in existence. But our survivorship team, we are here to kind of help coordinate, help to navigate, and we're here if patients and their caretakers want to reach out and have, you know, a more personal one-to-one conversation. Hope that answers your question.
Very good. I don't see any other questions in the Q&A. Again, if you do have questions, please type them in so we can address them.
Sasha, I think someone's asking how they can access the presentation afterwards.
Yes, so we did get a question about accessing the presentation and then whether or not it will be available after we close tonight. And the answer is yes to that. So we will be sending out an email, there will be a survey, and then you would have a link to the video presentation so that you can review these resources later on. I know we fit a lot of really great resources in these slides, and I myself will be going back and reviewing some of them as well. Here's another really good question. Are these services available to recipients of autologous transplants? So when the cells come from the person's self.
I'll answer that question. Yes, our services are available to anyone that has had a transplant. So yes, all transplant recipients, regardless of the type, caregivers, and your providers.
Okay, and then we have a question from Steve Bickler, and I'm very fortunate to know Steve well. He is also one of our volunteers in the Peer Connect program, and he has spoken with many patients in his advocacy efforts. So he has really done a great job connecting with his community in this post-transplant survivorship period. And he was wondering how we could better promote this specific service to patients before they leave that very acute period. So that period of time when they're close to us, kind of really within that umbrella of transplant before they transition back to their medical home or their community.
I can answer that question as well. So as our program is expanding, we are working on changing ways to connect with patients or transplant recipients earlier in the process versus waiting until after they're done and out of that 100-day period. So that's something that as a team we're working on. We're gonna study to make sure that we're, excuse me, we're gonna study to make sure that we're doing it the best way. But our plan is to make outreach sooner in the process versus later.
Very good. Thank you, Dee. We do have another question. So this is coming from a caregiver to a pediatric patient. And their question is with regards to how to best use that app. Should they enter their data as the parent, or should they enter the child's data?
I would suggest them as the parent entering as the caretaker, as that's what they are. And and then going through the app with the access that you get as the caretaker. And I think it'll be most appropriate and most fitting for the parent to be looking at it then and seeing the information that they have access to.
Very good. I don't see any more questions now. Maybe we could give it another minute or so. Anything else that you guys can think of might be useful for the community to know?
I would say if you have any questions at all, please do reach out. It doesn't matter how big or small. We're here to support you. We want to make sure that you have all the resources that are available to you. We want to make sure that you feel like you have someone that you can come to at any time. So please reach out to us when you need us.
We did have another great question come through. Steve is asking, is caretaker interchangeable with caregiver? The former sounds like tending a garden.
I probably use the terms interchangeably throughout speaking. I don't know that I was that conscious of which term I was using. So throughout my presentation, yes, they were interchangeable.
Thank you for bringing that to our attention, Steve. You know, even seeing patients in the clinic, I often will refer to them as their caretaker, but really that care I could see as being given to that person as opposed to being taken in that process. But it's really a bi-directional process too, because we know that both of our patients and their caregivers are diagnosed, right? And so a diagnosis affects the family, and there's giving, I think, on a two-way street. That support goes both ways, even when the survivor themselves is struggling and really needs that additional support during that period of time. I've noted that really they're doing the best to give it back to, and that's the challenge, right? Is that there still has to be this giving in both directions, even when one party or both parties are exhausted. And so what I think is wonderful is that you guys have all of these resources, and that caregivers are included in these resources as well.
Yes, and they really genuinely are. A lot of what our social workers meet with are the parents or the spouses or the siblings, you know, those who are the right hand to the patient, you know, the person who is there through the thick and thin of it all. They need support too, you know, and we are available to them as well. And likewise, too, a lot of the outreach that we receive, it's not abnormal for that outreach to be coming from the parent or from the sibling or the person who's sitting at bedside, that they'll be the one sending us messages on the patient's behalf and asking those questions. And that's entirely okay. That's fine. And it's encouraged.
I know personally that I advocate patients to take advantage of the counseling services. Could you just, and I know that you had spoken to this a little bit before, but could you tell us a little bit more about what that looks like if a patient feels like they're maybe struggling with anxiety, depression, stress in that post-transplant period of time? You know, how long these services would be available to them, what that looks like. Are they in-person services, virtual, or the phone, and how would they access them again?
I can
Go ahead. Yeah,
answer.
sure. Okay.
Yeah, I can answer. So our counseling services, you have the option of virtual or phone. So to access them, you would go through our link on the website, and there is a link that you would click to register, and that information goes out to our team. And then from there, the team will contact you to get services set up. Now, as it's referenced on the slide, there's 8 50-minute sessions. It's what typically is offered, but just, you know, it's kind of individualized according to where the needs are. So the best thing to do is just to start the process. Definitely, if you at any point, again, we're here to support you. And if you feel like you need, even if it's just one quick session to talk to someone, go ahead and reach out and register, and our team will connect with you and get things set up.
Mm-hmm. And really want to put a plug too that it's referenced as counseling services, but it's more than counseling, that it's emotional support services for your patients and the caretakers, caregivers. That counseling sometimes gives people a different thought, that sometimes, so just knowing that it's there for emotional support, it's something that I feel everybody should be a part of. I always tell patients that you've got your dentist and you've got a hairstylist and you should have a counselor too, or a social worker. It's just one of those things that I think really helps to make everybody well-rounded and keeps you all healthy. But yes, as Dee said, that they are here. Typically they're offered up to 8 weeks, but by no means would anybody be cut off at 8 weeks. There are several clients that are on for months because it's necessary. There's no cutoff to it. And again, these services are free. There's no charge to it either.
Very helpful when we consider the financial toxicity of cancer treatment or transplant and some of the post-transplant financial ramifications, not being able to transition back into work right away, or to have caregivers displaced from their work or their ability to bring in income as well, can be very challenging. And that is often the time when our patients need these services, right? And don't often have coverage or have minimal coverage. And I hate for that to be a barrier. Our mental and emotional health is so important that I think you offering these sessions for free is a way of keeping this community healthy. It's a way of really making sure that they're making it past the physical demands of transplant and really have the coping skills and resources to be successful going forward. We did have another really great question that came through. How do these services discussed here we interweave with the U of M Transplant Center?
I didn't quite catch the whole thing. What did you say?
So the question is, these services that were discussed during this presentation, how do they interweave or how do they work in conjunction with the services that are offered through the Transplant Center?
So we want to make sure that we highlight that our services are not intended to take the place of the care that you receive at your transplant center. What we want to do is to just to kind of strengthen those and be an extra resource that's available. So, if you had a question that was just, something that could quickly be answered without having to reach out to your center, you could definitely ask us, but we aren't going to do diagnosing or prescribing. We want to make sure that we're being hand in hand with what they're doing. So we aren't taking away anything that they're giving. We're not going to give you any different advice. We're going to just, everything that we provide, it will be based on guidelines and evidence that's out there to support your ability to thrive after transplant. So it's a team effort. We're working together. Long story short, team effort. So.
Right. Exactly that. We're not, in no way are we competing with anybody. We are here to complement them. We want to partner with them. If we have resources or information or access to, well, we want to share that. We want, at the end of the day, for these patients to thrive. It's not about us. It is about these patients, and it is about their health and their happiness, their well-being. And so we are here to partner with these transplant centers and facilitate this transition the best that we can for these people.
Yes, I love that answer. And I can say that as a provider stationed within a transplant center, there is not enough of me. And when I had first heard about some of the services that were being developed and first started utilizing the services that you had available online, that was huge. It was able not only to support my practice, but also it was this incredible resource out in the community that I could refer patients to. And then a lot of the resources that you guys provide to the center itself supports us in the day-to-day management of our patients. So it really is this strong collaboration, and what's provided by Be the Match, no individual center would have their resources really to develop on their own. So it's a resource that's available to all of the centers so that we can take better care of our patients, and so that you can also have more resources available to you and at your fingertips when the provider really just can't be anymore. So I would love to talk to every single one of my survivorship patients every single day, but it's the reality of it is having this service through Be the Match is one of the best things that I could ask for my patients.
That's so good to hear.
Yeah.
We did have another great question come through regarding the Peer Connect program. The question is with regards to the ages. So is it available for all ages, including elementary ages?
Right now, no. I believe at this point, 18 and older is what we have for our patient volunteers. So we do not have it open to all the pediatric population, but give me time. My background is all pediatric medicine, and so I'm very eager to grow some of these resources. But at the time, no, we do not have that for pediatrics.
Thank you. We did have one other comment come through with regards to the survivorship care plan. And this is a part of the service that you would offer. So if a patient contacted you, you could kind of, I believe, discuss with them some of their unique risks based on the type of transplant they had and their exposures and so forth. This patient said that during their survivorship visit, it was recommended that they receive skin cancer screening, and during that screening visit a second basal cell carcinoma was identified. And so just really great to hear all the way around that services like an individualized care plan, or informing patients of potential risks and encouraging them to get preventative services can be really important.
I totally agree. As Sarah mentioned, one of our takeaways, post-transplant period is complex, and there aren't going to be any two journeys that are the same. And so having that individualized set of plans, or the survivorship care plan, is something that will be very helpful to make sure that all of those important points are being touched on, followed, monitored. Just a really good way to make sure that all of your post-transplant needs are being met. So it's a very really valuable tool.
Well, I think with only 5 minutes remaining, we won't have much time for any more questions, but please do feel free to reach out to us or our team members here. I can't thank you enough, Sarah, Jen, and Dee, for your excellent and informative presentation. I think all of us learned. I've been utilizing your service as a provider for years, and I learned today, so thank you so much. We do have just a few announcements, so a few quick reminders here. The recording, again, will be available on our website by the end of the week. So check out the website. You will also be getting an email shortly with a quick survey to help us continuously improve. So if you could go ahead and fill out that survey. The benefit of that is A, we improve, but also B, there is a potential swag bag up for grabs. So if you do fill that out, you might get a bag full of goodies. Additionally, we just wanted to let you guys know that tonight officially marks the close of our fall series. However, we are really excited to share that our annual Cancer Survivorship Conference is scheduled for Saturday, April 15th, 2023. So mark your calendars. We'll cover a lot of really great topics during that conference as well. You can also join our email list if you aren't already on it, so that you get more information about what services we offer, future Thrive series, etc. And you can do that by going on to our website at survivorship.umn.edu. And then we just wanted to remind you that the new Thrive series will be kicking off in 2023. So take a look at your inbox, make sure you're checking out the website for more information and details about that. Again, thank you all so much for making this session and the fall series a huge success. It's a success because of our speakers like Sarah and Jen and Dee here tonight, but it's a success also because of our community. So thank you so much for joining this fall season, and we hope that everyone has just a wonderful night and a great rest of your week.
I'm going to add one more thing really quick. I'm so sorry. To the parent that was asking about support for their child. It's not a Be the Match NMDP site, but just from practicing peds medicine before, go to stupidcancer.org. It's a great, great site for pediatric patients that offers a lot of resources and support and education and opportunities to connect to. It's kind of focused more towards the adolescent and young adult population, but it's a really well done program. The name is kind of silly, but it resonates with the pediatric population. So stupidcancer.org.
Love
Okay,
it.
I'm done.
Thank you, Sarah. Yes, super helpful. Thank you. Thank you. All right. Well, have a good night, everyone. Thank you again to our speakers.
Thank you, everyone.
Good night, everyone.
Good
Thank you.
Thank you
night.
for having us.